Hello and welcome to 18 WJTS in.form. I'm your host, Bill Potter. There's a new program coming to Memorial Hospital in the area, and we're going to find out about that as we talk to two doctors who will be involved in that program. That is the new Family Medicine Residency program. We're going to find out about what that means in a minute. First of all, we'd like to introduce Dr. Tretter. He is a practitioner of family medicine.
That's correct.
And we also have Dr. Stroud. He is a practitioner of family medicine as well.
Yes.
Both local boys, in that you're from Spencer County originally and you're from Knox County originally, correct?
Yes,
okay.
That's right.
That is correct.
Well, I mentioned this is the new Family Medicine Residency program. For people to see something, I'm sure they see the new building that is going up behind St. Joseph's Church.
Right.
But what is the Family Residency program? How is that different than what didn't exist before?
A residency program is a training program for new physicians. So after a medical student graduates from medical school, they have their medical license, they then enter a residency program to specialize in their chosen field. So in our instance, these are physicians who will practice family medicine. It's a 3-year training program where these physicians learn how to be family physicians. And this is a program that will be sponsored through the Indiana University School of Medicine, but located on our Memorial Hospital campus.
Okay, and you're going to have a new building, right? The new Family Medicine Center. Tell me about that.
With that, Memorial, just in, again, showing their support for this new family medicine residency program, has decided to build a new building to house this and to take care of the patients there. That building is scheduled, and as we all know with construction, sometimes that can be off a little bit, but late summer is what we're looking at opening that particular building.
Okay, and I don't mean to be dumb, but sometimes I am. Family medicine as opposed to other medicine. Explain the difference.
With that, again, as Stan already alluded to, when you graduate from medical school and you have that MD degree or DO degree that allows you to be called a doctor, that we all graduate with similar degrees. Our residency is where we actually go into that stage of training where we learn our trade, so to speak. And if our trade is family medicine, we spend 3 years studying the broad spectrum of family medicine, which consists of inpatient and outpatient medicine. It consists of pediatrics, OBGYN, internal medicine, a whole wide array of things. So family medicine is the most broad of all the specialties, if you will. And again, you can go into many other different types of residencies: general surgery, emergency medicine, ENT. There's just a whole gamut of different things that people can go into once they've earned their doctorate degree. And family medicine is just what we're doing here at Memorial Hospital.
And why is this good for DuBois County Memorial Hospital and the area? Why is this family residency program good?
Ultimately, there's 2 goals, a short-term goal and a long-term goal. In the short term, as we're training these new family physicians, this will give more access to people in our community to have primary care, because these family resident physicians take care of patients just like any other family physician would. They're in training, but they are actively taking care of patients at the same time. They're supervised by board-certified family physicians who are assisting them in their training. So this will increase our access, so people who need primary care physicians will have a new avenue to access that care. But in the long term, as these residents graduate, they finish the program, our hope is that some of them will locate in our communities and set up their long-term practices. And the statistic is that about 70% of residents will practice within 100 miles from where they did their residency. So by having a residency located here at Jasper, we hope that many of these will ultimately become family physicians in our communities.
And this is not something that's ever existed, this residency program in Jasper.
That's
right?
correct.
Okay.
There's actually just one residency program in the southern half of Indiana currently. So there's certainly a need for more residency programs. And so we're excited that to partner with the Indiana University School of Medicine to create this opportunity here.
That is excellent. Now, obviously you guys are beyond your residency. Where did you do your residencies?
I actually had split training. I did my first year of residency at Naval Hospital, Jacksonville in Florida. And then I did the last 2 years of my residency at Deaconess in Evansville.
Okay, so there it might be the case of within 100 miles, you say. And then
That's correct. And I also went to Deaconess for my 3-year residency program. So it's insane.
What do you think is the most valuable part about the residency program for the new incoming doctor? What's an experience maybe you had that you learned or you found most valuable?
Well, I think that this will be a unique program in that it's community-based, so we're training doctors how to practice in communities that they will be familiar with. A lot of residency programs are at large academic medical centers, in Indianapolis or Chicago or big cities, which of course you have a great experience there, but it may not be what you're going to experience in a rural community. And so I think we can more likely mirror what their experience would be in a community setting.
I agree with that. And again, sometimes in an academic setting, a large setting with multiple residencies, residents sometimes compete for patients, so to speak. There aren't enough patients to go around. What will be good about, just like where we trained at Deaconess, where there was just one residency, same thing here. We're going to have one residency at this point where all the family medicine residents, they won't have to compete with anyone else. And they're also going to get to know all of the specialists and other local physicians in the area and become comfortable with those individuals, which is one of the reasons I think why a lot of physicians choose to stay close to their residency training program. They're already comfortable with how the healthcare system works in that area. They're comfortable with the specialists that they're going to be utilizing in consultation. They're comfortable with the hospital, the different departments of the hospital. So it just is one of those things that it just seems like a natural shift just to stay in the area once they graduate from the program.
Tell me, what will the center be like? Will it be like doctor's offices, or will it be like a mini hospital? What does the new Family Medicine Center, what is it?
So the Family Medicine Center, which is located at the corner of Bartley Street and 13th Street, really, which is about 2 blocks from the main campus of Memorial Hospital, will house the residency program in terms of a physician office. So there'll be, just like any other physician office that you would go to, a large waiting room with many exam rooms, procedure rooms, lab capabilities. All of that will be located in there. But in addition to that, it will also have conference room and classroom space, because again, these are residents in training, so it's also an educational center as well.
Okay, but for surgery, you would go see your family medicine doctor, and then you would go to the main campus to get something.
That's
done
correct.
If you had to, unfortunately, if you would have to have something done.
That's correct.
Is there anything you'd like to add about the new center, the new residency program?
Well, I think along those lines, we talked about the fact that in the actual Family Medicine Center, the building, you're going to have a regular family medicine clinic that is run by the residents and overseen by the faculty who are teaching the residents. But those residents are also going to be rotating through different places in the hospital. For example, they will have a general surgery rotation where they'll be with the local general surgeons working with them on cases and things of that nature. They'll be on the labor and delivery unit at the hospital, working closely with our own faculty and also the OBGYN services there at the hospital. So these residents are going to be getting the full spectrum, the full gamut, if you will, of family medicine, not only in the outpatient setting of their own clinic, but also on the hospital side and spending time with the local specialists in their offices.
Are you then faculty? Will you be faculty as well?
Dr. Stroud is going to be the program director, so he will oversee the program, and my role as the chief medical officer at Memorial Hospital just helps to support the program as well.
Okay, I don't know if we should call you Professor Doctor. It sounds like an exciting program and one that will benefit really Southern Indiana, not just Jasper, but all of Southern Indiana.
That's correct. We're real excited to be part of it.
Well, gentlemen, thank you very much, and much continued success.
Thank you very much.
We have had with us as our special guest Dr. Rex Stroud and also Dr. Stan Tretter. They are with the new Family Medicine Residency Program and Center and Memorial Hospital and Healthcare Center. And that'll be opening, what was the dates again? We're hoping the residency program starts.
We're hoping that the residency program will start July 2019 will be our first class.
Okay, and then the center will open sometime shortly after. It depends on construction, however that goes.
That's correct.
Exactly.
Doctors, thank you very much for being with us.
Thank you.
And thank you for watching WJTS in Form. We are local people watching local people.